So today I get to be the patient again, get to enjoy the sofa, enjoy the view, but importantly today I am having my hygiene, which I try and do every sort of 3 to 4 months. But today I'm going to get my plaque scores done and I'm going to see if I can beat your score, Keely, which was 24, is it percent?
Yeah.
So that's the one to beat.
Yeah.
So that's, you know, let's see.
For yours.
Yeah, you're right.
In the hot seat.
Yes.
Right. Is it in for your hygiene appointment? Any problems at all with the gums or the teeth?
All good, all good. I did have to have a couple of fillings, and I think you spotted something last time, so I don't know if I am bushing as well as I might be.
That's all right, well you can go over that. And there's no changes to your medical history?
No.
Right, let's have a look. Just put this round you. So what's your current brushing routine? Are you using an electric or manual?
Electric toothbrush,
Yeah.
Oral B,
Yeah,
morning
perfect.
and night, full 2 minutes. Honestly, I am.
Yeah.
30
No,
seconds a
good.
quadrant, but battery keeps going.
Yeah.
So you spend like 3 or 4 days manual, and then finally get round to charging
Charging
it.
it, yeah.
Oh, yeah.
Yeah. Any floss, anything to clean in between
No,
the
I
teeth? We'll go over that. I'll get the brushes for you. Right, we'll put the glasses on.
Thank you.
Okay, so what I'm going to do is just pop the chair back and we'll assess the gums and the teeth first, and then I'll chat you through everything.
Thank you.
Is that comfortable?
Yes,
Okay, I'm just going to check on the outside first. Just open and close. And again. Yeah, that's all good. Just going to check around the mouth. You just stick your tongue out for me, that's it, and move it to the left and to the right, and then the roof of the mouth. It's all nice and healthy. So yeah, what we're going to do first then is just check the gums, just to see the health of them. Upper right 0. Anterior 0. On the lower left 8 on the mesial. Okay, so with those numbers, the 2 just means there's a little bit of plaque there, okay? So just around the lower teeth, we've got a little bit of plaque building up, and the 1 just means there's some bleeding. So again, a little bit of bleeding as well, okay? There's nothing to worry about. What we'll do is we'll just pop on the purple dye on the teeth, just so we can have a look at the brushing. I'm just going to call some numbers out to Anna, and then we'll take some pictures and I'll show you in the mirror. Upper right 7, mesial. Upper right 6, mesial.
Yeah, go on then.
okay.
So hang on, Keely was
Reminder.
24%, 24 to beat.
24 feet, and it is 19%.
Hey! Convincing, not even close.
Yeah, we like it under 20%.
Oh, brilliant.
So yeah, you're on track. The bleeding score is 3%.
3?
And again, we like bleeding to be under 10%.
Under 10?
That's what we consider healthy. So the gums are nice and healthy. Right, what we'll do is we'll take some photos just so I can show you the areas.
What was your bleeding score, Keely?
I think it was 3%.
It was the same.
Yeah.
Yeah, but it was low. It was
Just gotta
definitely, it was definitely low. Yeah, it was, I think it was like 3%. So if it's a darker purple, it will have been on there for 3 or more days, and if it's lighter, that's probably come up in the last 24 hours.
Right.
So it's the darker ones that we're more interested in, because that just means areas that we might be missing when we're brushing.
So Keely's missing more areas than she's brushing, is what you're trying to say.
So bleeding means there's some plaque on the gum, okay, and bacteria, and it's just got slightly inflamed. So we just want to stop the bleeding, because that just means there's a bit of inflammation there, okay. Right, let's take some photos. So yeah, you can just see in between the teeth, Just where the dye is, that's just where your plaque's building up, okay? It's just an area to concentrate on.
And so that's where my TPs would get?
Yeah, definitely, that's why they're very important to get in between the teeth. So what we'll do is we'll size the TPs up for you now, because it's really important to have the correct size. Because if anything's too big, too loose, it's just not going to be as effective at removing the plaque.
God, I've done well with that dye, haven't I?
Yeah, no, you have.
Yeah, I'm really pleased with myself.
Right. Do you use TPs at the moment?
No, I don't use anything.
Okay. That's fine. I'm going to start with the smallest one and we'll see if we need any bigger, okay? Yeah, I'd say to use pink. So pink's the thinnest one. So what you're going to do is you're going to aim for the triangle between the teeth.
Yeah.
I'm going to push it all the way through and then in and out about 4 times. You don't want to go through just the once. And it's really important to make sure you're going between all the teeth, okay? Now you will get a little bit of bleeding to begin with. That's all normal, that's just the gums adjusting. It's just because there's a bit of bacteria there. Once you're removing that and the area is cleaner, the bleeding will stop. So it can take up to about a week or 2 weeks, but it will eventually stop. I would probably use pink between all of them actually.
Okay.
I'll try the uppers as well, but it makes it a little bit easier than when you only need one size. So I'd use it once a day.
You would, yeah.
Yeah,
to be honest, I would use those instead of floss. Floss is ridiculous, isn't it?
Yeah, floss is really tangly, and I think the brushes are a lot easier, and it's quicker as well.
Yeah, quicker, it's a speed thing.
Yeah, and I know everyone wants to get it done quickly. So I would use them once a day, in the evening ideally, just because you've eaten throughout the day.
Right,
so
okay.
It's really important to leave nothing on the teeth. What I would suggest as well is doing it before you brush your teeth. Just because there might be a bit of food, a bit of blood, you want to rinse that off and then brush your teeth, but to make sure you're not rinsing after you brush your teeth, so you're leaving the toothpaste on, okay?
I'm going to do it and then we'll see what those scores are like in 3 or 4 months.
Perfect. Right, so we'll get started with the cleaning then. So what we're going to do first is use the airflow, which always says a little bit like a jet wash for the teeth. So it'll be some water and powder, nice and gentle, and it will just get in all the grooves of the teeth, remove all the plaque and the bacteria, okay? Then afterwards we'll go around with the scaler to remove any sort of stubborn bits of plaque or calculus, okay? Perfect. Let me know if you need a break.
Will do.
Would you like to watch any Netflix with the headphones?
I would like to listen to some music if that's all right.
Okay, yeah.
Jurassic 5.
I don't know what Jurassic 5. You want Jurassic 5? I thought you wanted the theme tune to Jurassic Park. I wasn't going to judge that.
That's it. That's it.
I thought you wanted to listen to the soundtrack. I love the soundtrack. I love it.
Wow.
So yeah, you can just see where we started with the plaque, just in between and all removed. You can use the TePe brushes in there.
Perfect, thank you.
Right. We're going to put the Biomin on, which is fluoride toothpaste. And let's just add some protection after a clean, okay?
Perfect, thank you.
Just pop this on. If you can leave it on for about 30 minutes, it's just going to soak into the teeth just before you eat or drink anything.
Lovely, thank you very much.
We'll give you a hot bath.
Ooh, I'll give you those. What's this one, a mango?
It is the mango.
Mango and orange. Lovely that. Thanks, I appreciate that. Right.
No, that's fine. I mean, they were good.
They're all right.
19%.
If you'd have seen me like 10 years ago, they were. So I didn't
Well,
used to
yeah,
go.
no, they're nice and healthy.
Good. Was it 19%?
19%. But going for 10.
Ah.
So how did it feel seeing your images before and after, like close up?
Good. I mean, they're in good condition, which I was pleasantly surprised about. So there wasn't loads and loads to see, but it was nice to see them. Felt good about that.
Would you say you found out more information today than you knew already about your mouth?
No. I mean, I was hoping for more zeros than I got, and then some areas to focus on. To be honest, I've never used TePes in my life, but I think it is pretty easy, isn't it? I'll get some of those pink ones and give those a go. So it has changed. Well, we'll see. Ask me again in 3 months.
Airflow, it's a lot more gentle. The water is warm. It's like lukewarm, which everyone loves, because everyone always says to us, oh, they're sensitive, and that's usually because of the cold water. And it's a fine spray, so it's really gentle, and I think that's why people love it.